What is cervical traction, and how does it work? Cervical traction, often known as spine traction, is a popular treatment for neck pain and injuries. Cervical traction works by pulling your head away from your neck, allowing it to expand and relieve compression. It is regarded as an alternative treatment for neck pain, allowing people to avoid the use of medications or surgical procedures. It can be used in conjunction with physical therapy or on its own at home. Traction devices for the cervical spine. By stretching the neck and tugging or separating the vertebrae, you can relieve strain on the spine. It's considered to be incredibly effective as well as quick-acting. Continue watching to find out more about this strategy and how it might benefit you. The advantages of cervical traction. Different forms and causes of neck pain, stress, and tightness are treated with cervical traction devices. Cervical traction relaxes the muscles, which helps to reduce pain and stiffness while promoting flexibility. It's also used to treat bulging or herniated discs and flatten them. It can help with joint discomfort, sprains, and spasms. Neck injuries, pinched nerves, and cervical spondylosis are all treated with it. To relieve pressure and pain, cervical traction devices stretch the spinal vertebrae and muscles. Stretching or pulling the head away from the neck is done with force or strain. Compression is relieved when space is created between the vertebrae. What's the procedure? Cervical traction can be done with or without the assistance of a physical therapist. Your physical therapist can assist you in determining which method is most appropriate for you. You may be advised by your physical therapist to purchase cervical traction equipment for use at home. You might need a prescription for certain gadgets. Cervical traction devices can be found in medical supply stores and on the internet. Before you use the gadget on your own, your physical therapist should demonstrate proper technique. Even if you're undergoing a home treatment, it's crucial to keep in touch with your physical therapist. Traction of the cervical spine by hand. A physical therapist performs manual cervical traction. They'll gently lift your head away from your neck while you're lying down. They'll stay in this position for a while before releasing and starting over. In order to achieve the optimum outcomes, your physical therapist will make adjustments to your exact positioning. Mechanical cervical traction. Mechanical cervical traction is done by a physical therapist. A harness is attached to your head and neck as you're lying flat on your back. The harness hooks up to a machine or system of weights that apply traction force to pull your head away from your neck and spine. Over-the-door cervical traction. An over-the-door traction device is for home use. You attach your head and neck to a harness. This is connected to a rope that's part of a weighted pulley system that goes over a door. This can be done while sitting, leaning back, or lying down. Side effects and warnings. Generally, it's safe to perform cervical traction, but remember that results are different for everyone. The treatment should be totally pain-free. It's possible that you can experience side effects such as headache, dizziness, and nausea upon adjusting your body in this manner. This may even lead to fainting. Stop if you experience any of these side effects, and discuss them with your doctor or physical therapist. It's possible for you to injure your tissue, neck, or spine. You should avoid cervical traction if you have rheumatoid arthritis, post-surgery hardware such as screws in your neck, a recent fracture or injury in the neck area, a known tumor in the neck area, a bone infection, issues or blockages with vertebral or carotid arteries, osteoporosis, cervical instability, spinal hypermobility. It's important that you follow any safety instructions and recommendations provided by your doctor or by the manufacturer. Make sure you're performing the movements correctly and using the appropriate amount of weight. Don't overexert yourself by doing cervical traction for too long. Discontinue use if you experience any pain or irritation or if your symptoms get worse. Cervical traction exercises. There are several exercises that can be done using cervical traction devices. Make sure to listen to your body and go to your own edge or threshold in terms of stretching and the duration of your exercises. To use an air neck traction device, place it around your neck and adjust the straps as necessary. Then, pump it up and wear it for about 20 to 30 minutes. Do these a few times throughout the day. You can wear the device while doing activities where you tend to slouch. To use an over-the-door neck traction device, you'll start with about 10 to 20 pounds of pulling force, which can be increased as you gain strength. Your physical therapist can recommend the right amount of weight for you to use. Pull and hold the weight for 10 to 20 seconds and then slowly release. Continue this for 15 to 30 minutes at a time. You can do this a few times throughout the day. A posture pump. Edit sign. Is used while you're lying down. Do a warm-up before using this device. Slowly turn the head side to side, then forward and backward, and then lean the neck from side to side. Do each exercise 10 times. Then, attach the portable device to your head and increase the pressure so it tightens around your forehead. Once it's pumped, wait 10 seconds before releasing the air. Do this 15 times. Then inflate the unit and relax in a comfortable position for up to 15 minutes. Make sure you're not pumping it too much, especially in the beginning. Once you release yourself from the pump, keep your head in line with your spine as you come into a standing position. Repeat the warm-up routine. You may also wish to incorporate stretching into your daily routine. You can use accessories such as exercise balls or resistance bands. Yoga is another great tool to relieve neck pain, and there are plenty of cervical traction exercises your physical therapist may be able to recommend that don't require any equipment aside from a bed or table. The takeaway: cervical traction may be a safe, wonderfully effective way for you to resolve neck pain. It may provide you with numerous improvements to your body, inspiring you to do it often. Ideally, it will be effective in relieving neck pain and enhancing your overall function. Always talk to your doctor or physical therapist before beginning any treatment. They can also help you to set up a treatment plan that addresses exactly what you need to correct.